All right, thank you everyone for joining this presentation. It is the first presentation of the 2018-2019 enrollment year of the Milwaukee Enrollment Network. The Milwaukee Enrollment Network is a group of over 100 organizations in the Milwaukee County area that are all working together to do enrollment work, whether it's getting folks enrolled in Badger Care or the health insurance marketplace, making sure that there's sufficient outreach and education in the community for people to understand their healthcare coverage, making sure that there's enrollment events that people can access in their areas, in their neighborhoods, throughout open enrollment and the rest of the year, and making sure that enrollment assisters like yourselves have the information that will make them able to provide the assistance that our community needs around healthcare coverage. I've now been in my role as program manager. Let's see if I can, what's the next slide? Program manager for the last 2 years, full 2 years, and then program manager of the Covering Wisconsin Navigator program for the last 3.5 years. And as you know, with all things related to the Patient Protection and Affordable Care Act, it has been a wild and crazy ride. Every year is a little different. Every year there's been changes, and with a new president and administration, the last year of changes have been even more stark than, you know, when we were worrying about computer troubles and Healthcare.gov crashing. So things are different. But I'm still here to help you answer questions, help you get your CAC certified, help you kind of navigate the navigation process that is the ACA, and how we're able to help folks enroll in both Badger Care Plus and the health insurance marketplace. So today we'll be talking about modified adjusted gross income. I say that, and every time I say that, I kind of squish my face because, of course, it's a topic that we have to talk about and we have to understand, yet isn't that just one of the grossest, it's grossest in the name, grossest terms you've heard about, you know, having to explain to someone who just wants healthcare? Regardless, we're going to talk about it. We're going to make sure that you feel comfortable talking about it, or at least understanding it, so that when someone comes in, you can explain it to them in maybe a more easy way. All right, so what are we going to be talking about today? Well, we have 3 major takeaways that I would like for everyone to understand. 1, what is modified adjusted gross income? How can we easily explain it to someone coming in when they're trying to sign up for coverage, and we can get them to a point where they understand what information they need to tell us. 2, household size for marketplace enrollment. Household size is one of the big ways to determine what income you're counting, because it allows you to figure out whose income you're counting in your household. And then 3, what type of income counts under the modified adjusted gross income rules? It's not, you know, what you decide to reveal. It's not just some of your income and not a lot of your income. There's some rules set in place that allow people to understand what is it that when they're enrolling in marketplace coverage, do they have to share. And now, before we even get started with the content, here are the disclaimers. I, Caroline Gomez-Tom, am not a tax expert or a lawyer. So this information has been gained from a lot of different references, and it is factual. I've done my research, but at the same time, I am not here to tell you I know it all. So if there's a mistake, or if you have questions, don't hesitate to ask. We can make sure that things are updated. If there's a mistake, I apologize. But for the most part, I've done my due diligence to make sure that this is factual information that will benefit your work. 2, the presentation will focus on the modified adjusted gross income as it relates to the marketplace. As you know, there are modified adjusted gross income rules that also apply to Badger Care and Medicaid. However, the rules vary in different ways, and because I'm not representative of the Department of Health Services, I'm not going to dive deep into how MAGI applies to Badger Care. I'm going to really skim the surface. Of course, the presentation will not be void of information about Badger Care because, as you know, the Affordable Care Act and Medicaid are closely tied together, but I will make sure that, that we really keep our focus on the marketplace. The third little disclaimer is what I like to tell everyone about all of the policy that we work with, is that reality can sometimes seem different from the policy. And what I mean by that is that we have a policy, we're told that this is law, this is what it is, and then you have a consumer in front of you, and you hear their story, and you figure out, oh, even though this is the policy, it's not working for that consumer in that way. And so that happens. And I hope that with this presentation and with others, you have more tools to identify those moments when reality doesn't seem to be matching policy, so that we can bring it up as a group of informed individuals. Because it's not always the consumer that will understand that something's supposed to be happening, but it's not. It'll be the person that's assisting that consumer. That'll be you. Questions are a good thing. I'm pretty sure that by the end of this presentation, you will end up with more questions than answers. And that's just because modified adjusted gross income is complicated, as is health insurance. And so the questions are a good thing. It will help us learn together, and it will also highlight the things that maybe I should have included that I missed. And we are here to work together. The Milwaukee Enrollment Network is a huge consortium of very dedicated individuals. Having worked with you all for the last several years, I know that we can do amazing things when we're working in unison and we are trying to reach all the people for the right reasons. And this doesn't change for this year. We have a busy year ahead of us, especially as we get closer to the open enrollment period. We have a lot of exciting things that we'll be adding this year, like a Badger Care Plus promotion campaign, and many other resources and different types of strategies to make sure that we're reaching as many people as possible. And I can't do it by myself. I can do it with you. So thank you for participating in this presentation, and let's go. All right, so first section, what is modified adjusted gross income? I looked and looked for different definitions, and a lot of them pointed to the 1040 tax form and addressed that, you know, it's this line minus this line plus this stuff. And by the end of it all, I thought to myself, what is the easiest way to explain what it is? Well, it's money. It's the money that a person makes and his or her household makes that can be taxed, minus some costs to that household. And those costs are deductions that they can take out of the initial amount of money that can be taxed. And then plus some non-taxable money that the person or his or her household gets. And that is MAGI. So we're done, right? We can leave. So that is the simplest way that I feel like I can explain it. So it's the money that a person gets that can be taxed, minus their deductions, plus some non-taxable money. And that amount is this magical number that is modified adjusted gross income. Why do we even use MAGI, or modified adjusted gross income? Well, the straight answer is it's the law. The Patient Protection and Affordable Care Act, which we know as the ACA, requires that MAGI is used to determine eligibility for health insurance coverage and financial assistance in Healthcare.gov. So when people are applying for coverage, this is what they use to determine how they stack up based on like the federal poverty guidelines. MAGI is essentially a set of rules that allows for someone's income to be compared to the income limits to qualify for different types of assistance. And we use it for Badger Care Plus in some cases, but in some cases they use different rules, like the household rules is what they call them. But like I said, not taking on that beast. Then there's marketplace tax credits, so the lower premium costs, the discounts that help lower those monthly premiums, that is set based on what the consumer and their household modified adjusted gross income is. And it's based on how that compares to the federal poverty limits that they set in place. And then marketplace cost sharing reductions. So for folks to qualify for the lower deductibles and out-of-pocket costs in silver plans, they use MAGI to determine that eligibility as well. If they didn't use a set of rules or didn't align a set of rules, then there would be no way to really measure one consumer to the next. This is a tool that they use to make sure that each consumer is using the same method of determining their income, so that it's not one consumer saying, oh, well, I'm going to use my net income, and another consumer saying, well, I'm going to use my gross income, or a consumer counting job income but not in-kind income that they receive for doing this side job. It's a way to make sure that all the math kind of adds up and that everyone is doing their income consistently so that it can then be matched up to those income limits. Not all programs use MAGI rules, so that's why, once again, we're really focusing on marketplace eligibility. For example, elderly, blind, and disabled Medicaid and long-term care do not use MAGI rules. So now, who makes up a household under MAGI rules? Before we can really get into what's counted under modified adjusted gross income, we have to know who are we counting from. What is the household and how is a household size made up? And why does household size matter? Well, it's part of the equation when you think of modified adjusted gross income. Household size is needed to find out who will qualify for what programs or financial assistance. As you see in this slide, I put down the Badger Care Plus eligibility and the marketplace tax credit eligibility limits because those are really what we're basing off of. And as you notice, based on household size, as household size goes up, the household can make more money and still qualify for certain programs. And like I said, Badger Care Plus is a whole other ballgame. So MAGI does apply in some circumstances, but in other circumstances it does not. So the way that we're looking at it in these charts are based on the MAGI rules. I also linked the Covering Wisconsin Health Insurance Literacy Health Insurance Options for You and Your Family sheet. This is a nice resource. It does have these charts on the back of the sheet, but it also walks through the different options that are available to a family around their health insurance. So it discusses employer coverage, Medicare, Medicaid, or Badger Care, and the health insurance marketplace. And it's a nice sheet when you're just talking to someone and trying to walk through what is available to them, regardless of their situation. So then how do we find what a household is for modified adjusted gross income, specifically for marketplace eligibility? So the easiest way that I explain it to consumers when we're working one-on-one is your household is not necessarily who you live with. In Badger Care, that is usually more the case. But for marketplace, it's who you file taxes with. And so you have essentially two types of individuals that can be a part of your household. You have the tax filers and their dependents. So we're going to kind of walk through both of those categories. But first, who needs to file taxes? How do you become a tax filer? Well, things have changed for 2018. There was a tax law that passed in early January, and someone will need to file taxes, one, if they are making over $1,050 per year in taxable unearned income. What is taxable unearned income, you ask? Well, mostly that is investments. So if someone has stocks or other types of bond income where they're receiving something for not necessarily working or giving a good or service, that is considered unearned income. And so that's why it's a lower threshold. But for the folks that we usually work with, that's usually not a type of income that we see a lot of. So then the other type is $12,000 per year in taxable earned income. So if you notice, that's actually a lot higher of a threshold than it has been in the past. So with this new tax law, the amount that someone can make has increased significantly before they need to file taxes. So this is earned income. So this is jobs, renters' income. So if they're receiving rent from someone where they own a home, and other little, even cash income, that's what is considered earned income. So once we know someone needs to file, we kind of figure out, okay, so what is their tax filer status? And there's technically 5 statuses, but I only put 4. The 5th that I didn't include is widower status. So someone who lost their spouse and they have a tax dependent, they can file as a widower under the widower status as long as they have a dependent and they can file that way, I guess, for 2 years. Then there's these 4 other more common tax filing statuses. Single is a person who's unmarried, legally separated, or divorced. And so the legally separated and divorced, they have to be, through court order for them to be considered single in this category, or they have never been married. Married filed jointly is a person who's legally married and files taxes with spouse. That's pretty straightforward. Then married filed separate is a person who is legally married but files taxes separate from their spouse. And then head of household. This one's actually new to me. Doing my research through this process, I learned about head of household, and I think this will be interesting for folks who might be in some unique situations. So head of household is a person who is viewed as unmarried, and we'll talk about what that actually means, and has a child dependent. So there's some more specific rules for someone who can claim head of household, but typically it's someone who might not be legally separated, but their spouse has not lived with them for 6 months of the whole year, and they have a dependent, and they are in charge of providing at least more than half of the household income. And so if that's the case, then there's this kind of special category of head of household. And one thing that most of you know is when someone is married, they have to file jointly for them to qualify for tax credits. If they are married and they file separately, they cannot qualify for those tax credits. However, there are some exceptions for people who experience domestic abuse or spouse abandonment. They can file their taxes and apply for marketplace as single. And then this head of household category can also apply for folks to apply as single, but they have to follow all of the rules that allows them to apply as head of household. And I believe that there is a limit in how many times you can file as head of household as well. And then we know to qualify for those tax credits, people have to agree to file their taxes. And this is important because we've seen people lose their financial assistance after not filing their taxes. And then they have to go back and file taxes in order for them to get either tax credits retroactively applied, or they will lose out on those tax credits for the year that they didn't file. So for example, if someone had marketplace coverage in 2017, but then did not file their taxes for 2017, but they got the tax credit for 2018, there's a chance that the marketplace will find out that they did not file taxes in 2017, and they could actually take away that tax credit for the rest of 2018. I've seen that happen. And the person would then have to go back and file their 2017 taxes, get it approved, accepted by the IRS, and then go back to the marketplace to essentially set up an appeal or sometimes an escalation to get those tax credits reinstated. Or if they don't get their 2018 tax credits taken, when they go and apply for 2019, there's a chance that those tax credits won't be available to them. So it's very important when people are applying for marketplace coverage, they are agreeing, especially if they're getting tax credits. If they're not getting tax credits, they're not obligated to do their taxes. But if they are getting tax credits, they are agreeing to file their taxes for that year. So please make sure that you're letting people know about that. And Covering Wisconsin does have some tax related materials. So I would recommend going to our website when you have a chance and taking a look at those resources, because there are some nice tools in helping consumers understand what those tax requirements and rules are. So now we're talking about dependents. So as I mentioned, for tax filers, there's those 5 different categories, mostly those major 4 categories. But then for dependents, there's 2 types. There's a child dependent and then other individuals. A child dependent is someone who's a U.S. citizen or a resident of the U.S., Canada, or Mexico, lives with the tax filer for more than half of the year, is under the age of 19, or a student under the age of 24, or a child who is disabled at any age, and then does not provide more than half of their own income. If someone falls under that category, the tax filer can claim them as a child dependent. For other individuals, and when they say other individuals, they mean pretty much anyone that falls in these categories, the tax filer can claim them if they cannot be claimed as a child dependent by anybody else. They are a U.S. citizen or resident of the U.S., Canada, or Mexico, receives more than half of their support from the tax filer, is related to the tax filer and lives, is related to the tax filer or lives in the tax filer's home all year, and has a gross income under $4,050. And that was the number for 2017 filing. I couldn't find the updated amount for 2018, but I guess it does increase by inflation. So really, a lot of folks might be able to claim folks that live with them, that they take care of, like parents or grandparents that they take care of in some cases. Sometimes relatives that they are sending money to in the US, Mexico, or Canada, that they're providing at least half of their support. That can sometimes work out as someone who's being claimed as a dependent. I've seen that in some cases. And people who are just helping out a friend where they're literally paying their way and letting them stay at their home all year, that would also be a case where maybe someone would be considered a dependent. So with all of that, once again, I will reiterate, I am no tax expert. So usually when someone is unsure whether or not they can claim someone as a tax dependent, I would refer them to a tax expert. to make sure that they are at least looking at the options and are clear in what they can do when tax time comes, because we don't want to make a household bigger where they get a tax credit that's more money, but then when they file their taxes, they end up having to pay back tax credits because their household is actually one person or two people smaller. They might get the discount up front, but that doesn't mean that they won't have to pay it back. So it's better to be as accurate as possible when completing the application, making sure that they are aware of how them filing their taxes will impact their eligibility even later on. Yep. Okay. So then, children dependents, I just wanted to mention that usually the parent who the child lives with, or the custodial parent, usually claims the child as a dependent on their taxes. However, there are some exceptions. And so if there was a court agreement, usually from a divorce or a legal separation, that will actually, if that court agreement will become the rule. So even if a child lives with the parent, but there's a court agreement that the other parent can claim the child on their taxes, or there's like an agreement that they have to take turns, then that's what they have to do at tax time. And so if you encounter someone and they say, oh, yep, I live with both my children, they live with me full time, but when I divorced their mother got the part of the agreement that says that she'll claim them on their taxes every other year. So this year she's going to claim them. Then that's something that you'll need to find out to make sure that when you're putting in the marketplace application, you don't put the children in his household. So just as an example, if it wasn't, so if it's not court ordered, then it usually goes back to the rule of, okay, well, do the children live with you? Then yes, they're your dependents. But if there is a court agreement, the only way to change that court agreement is by filing a tax form 8332, where the other parent has to sign over the fact that they're going to let you claim the children on your taxes. So I'll make sure that this is available after, in case you encounter someone where they're like, oh no, I should be able to claim my children because they live with me. Then just letting them know, well, if this is a court agreement, you'll need the parent to sign this form. And that'll be a tool in case that's something that they actually want to do. All right, so we got to our first household size. And so now this is going to let me know if the chat box is working, because none of you are asking questions. I'm doing that great of a job, I know. No, I'm just kidding. So the first household example, so this is just household size. We're not even into income yet. Harry and Mary are not married, but they live together. Sorry, typo. They have one child together named Barry. They both agree to have Mary claim Barry on her taxes. What is the household size for the marketplace enrollment for their family? So anyone can type in the box. Who knows the answer? All right. Okay, so I have a couple people saying two. Two for who? 2 and 1. 2, 3. Ooh, good, we're getting all the answers. Okay, anyone else? Anyone else want to chime in? Okay. Anybody else? No? Okay. So The answer is, Sarah and Christopher Whedon both got it right in the chat box. So it would be 2 and 1. So Harry, because he's filing on his own, he is a household of 1. Mary and Barry, because Mary gets to claim Barry, they made the agreement that Mary gets to claim him, they're a household of 2. So this is specifically for marketplace. If you're looking at Badger Care, they could rope Harry, Mary, and Barry all together in one household because they have different rules if folks are living together but not married and they have a child together. But in the case of marketplace, this is what it looks like. And it could be that the next year, maybe Mary and Harry agree that Barry will be on Harry's taxes, and then Mary will be a single tax filer. So it can vary. Oh my gosh, I'm sorry guys, Harry, Mary, Barry. I thought I was being cute. I don't know if I am. All right, so now we're going to the next section. What counts as income under modified adjusted gross income? Remember, MAGI is the money that a person gets that is taxable and his or her household gets, minus the cost of the household, so what they can claim as deductions, plus some non-taxable money that the person in his or her household gets. That is MAGI. But what are we talking about? What income are we counting? MAGI does have some specific rules of what can be counted, what shouldn't be counted, what deductions can be taken, and what are those non-taxable monies that you can also include. First, what are the types of taxable income? I think these are the ones that we're usually aware of or most commonly aware of. Gross wages, salaries and tips, unemployment insurance, so when someone's unemployed, the money that they get, pensions, annuities, rental or business income, interest income and dividends, and cash income. So cash is actually a big one because a lot of people will, have these little side gigs where maybe they get paid under the table or they get paid just cash. They just get paid cash. But what they don't realize is that any cash income that they're getting is actually taxable, and they should be reporting it. And they potentially could get in trouble if someone like the IRS were to find out that they weren't claiming tax income. Once again, not a tax expert, but if you hear someone say, oh, and I get paid, but that's just some side money, it might be worth it to recommend that they talk to a tax expert just to make sure that they're going to be okay claiming the income that they're trying to claim. And then with taxable income, a lot of times people just focus on their work, like what am I making for work? But then they'll forget that there's all these other types of taxable income that they should be including. Like for example, they have a little home that they rent out to a couple and they get $600 a month for it. That is also taxable income. They should be claiming that amount of money. And a lot of times when we put that into the marketplace, the marketplace will look back in their database at old tax filings. And if it doesn't match what they're stating their expected income for this upcoming year will look like, sometimes it'll flag it and it'll require them to show proof or verification of that income. All right. So now, types of non-taxable income. The more common types that we see are Social Security payments, and that includes survivors' benefits and disability payments. And this is a type that folks kind of get confused because supplemental security income or SSI is not included when looking at income or countable income, but Social Security payments are. And so you hear the SSDI and SSI. Well, SSDI is counted, SSI is not counted. I know. Couldn't they pick different acronyms? I don't know why they couldn't, but either way, this is what we're left with. So if someone is receiving Social Security payments, like the money that they get when they turn 65 or older, survivor's benefits, or disability payments. Those are all non-taxable income that needs to be counted in their modified adjusted gross income. Another non-taxable type is foreign income, and that also can get a little funky, but most foreign income that they're receiving is non-taxable, but should be counted towards MAGI. All right, and then what not to include in modified adjusted gross income. These are the most common things that we know not to include. W-2 payments or welfare payments, supplemental security income, so SSI is not included. Child support is also not included. Gifts and inheritances, and that is actually to a certain amount, but usually it's a pretty high amount, so that usually is still not included. Grants, scholarships, essentially any school-related income, like student loans, that's not going toward living expenses. So if it's going to your tuition, books, segregated fees, any of that type of stuff, then that is not income. However, if you're using your grants to go to rent, then that can be counted as income. Salary deferments, like contributions to IRAs, Roth IRAs, veteran disability payments are not included in income, and then workers' compensation is not included in income. So I do not expect you all to memorize this. What I do recommend is that at the end of this PowerPoint, there's a list of references. All of those references are like my tried and true resources. So I really do recommend that you go through them and save them in a little MAGI folder so you know where to go to when you have questions of what's counted, what's not counted. Because like I mentioned, policy and reality don't always match. And when you have a consumer telling you, oh, no, I normally don't count this on my taxes, you're going to want to at least look back and say, hey, is that the case? And if you're really not understanding if they should or should not, referring them to a tax expert to make sure that that's clear. All right, so there have been a couple of changes to the way MAGI and tax law are counted based on the tax law that was put in place at the early part of this year. One is taxable income. Alimony will no longer be counted as income, or a deduction for that matter. So before, alimony was listed in the taxable income, but they made it so that it no longer will be. And that also means folks that are paying alimony to their former spouse, they will not be able to deduct those payments from their income. And then student loan interest will also not be deductible this year. That was another one of their changes. However, in the past, they have modified that as it got closer to tax time and retroactively extended it. So there's a chance that that might happen. And I mean, I guess that could happen also with the alimony payments. So if that changes, I will let you know. But as it currently stands for 2018, when people are filing their taxes in early 2019, alimony and student loan interest will not be a deductible, and alimony won't be counted as income. And then, as I mentioned earlier about who needs to file taxes, dependent income has also changed, where dependents can now make up to $12,000 in earned income before having to file their own taxes. And what this means is that when you're adding up the income for the household, if a dependent is making more than $12,000, then their income would count towards the household income. If the dependent's income is less than $12,000, then it won't be counted at all. And we'll look at some examples to make sure that that's an understood term. All right, so then when we're actually looking at the income, whose income are we counting? So when we're applying for marketplace coverage, we are counting the income of the tax filers and then their dependents who make more than the filing threshold. And so as I mentioned, it's $1,050 of unearned income or $12,000 of earned income. So dependent income is not counted if it's under that threshold. Social Security payments for a dependent are only counted if their earned or unearned income is over the filing threshold. So if someone gets $6,000 in, well, no, let's say someone gets $13,000 in Social Security payments as a child dependent, but they don't get any unearned or earned income, those Social Security payments for the child will not be counted in the household income for Marketplace. I'm going to emphasize that, for Marketplace. Badger Care is a whole nother story. But for Marketplace, those Social Security payments would not be counted. However, if that child, let's say, is 17 years old and has a part-time job, if they are making $15,000 at their part-time job and they have $6,000 in Social Security, then all of it will be added to the household income because their earned income is over the threshold. All right. So now we're going to go through the counting income example. And I know, see, I really was trying to be cute, guys. And here we are with some rhyming again. Sherry and Larry are married, filing jointly, and have 3 children, Lenny, who's 23, Benny, who's 18, and Kenny, who's 10. Sherry makes $28,000 at work annually. Larry started collecting Social Security this year and will receive $19,200, about $1,600 a month. All 3 children live at home and are claimed as child dependents. Lenny is a full-time student and has a paid internship of a $6,000 stipend. Benny is working part-time, making $12,200 a year. And then Kenny is 10 and enjoys playing hide and seek. Whose income will be counted in their household income? Go ahead, chat box. Do your worst. All right, we got one person saying Sherry, Larry, and Benny. Sherry, Larry, and Benny. Sherry, Larry, and Benny. Sherry, Larry, and Benny. All right. Any other answers? Are we ready? Okay, let's move forward then. And the answer is Sherry, Larry, and Benny. So why? Why is that? Well, Sherry and Larry are our tax filers because they're married and they're filing jointly. So their income will for sure be added together. So $28,000 and the $19,200. Sorry, missed the comma. And then Lenny's income, even though he's making $6,000, is not over the threshold for him to have to file taxes. So his income will not be counted. And because he's an adult child in school, he's still considered a dependent in that household. Benny, on the other hand, even though he's younger than Lenny, is working part-time, and he makes a whopping $200 over the tax filing threshold. So because of that, his income, all of it, will be included in that household income. So for their family, which would be a household of 5, they would have a income of $59,400, and really that would be their taxable income. Well, taxable and non-taxable income, but we don't know if they have any deductions or anything that will be included to reduce that amount. But for all purposes, we're just assuming that that will be their modified adjusted gross income. So Lenny is under the tax filing threshold, and Kenny's out there just being a kid. All right, so I do have an evaluation that will be sent via email. I'm also going to include it. Let's see if I can do that right now in the chat box so that you have access to it now, just to make sure that you'd let me know how I did. And then I'm opening the table for some questions. What questions do you all have? I know we're just about at the hour, but I did give us 30 minutes for any questions that folks might have. So if there's things that you want me to address, please feel free to shoot away. Here, I can also unmute folks to see what questions you might have. All right, any questions from the folks on the phone? All right, I got one that says, is there a way to get a copy of this presentation? Absolutely. This presentation is being recorded, so you will have access to the full recorded presentation, as well as the slide deck.
Why would a patient call and ask how much he has to pay?
I'm sorry? All right, so I muted folks again. And then any other questions? Oh, I'm sorry, let's see. What deductions would reduce MAGI? So that's a great question. And honestly, with this new tax law, that's changed pretty significantly. And so I'm even curious what's going to be included in the marketplace application. Because normally what would be deducted would be alimony, student loan interest. I believe moving expenses could also be deducted if it was for work purposes. But beyond that, there weren't really a lot of things that commonly are deducted for folks. So sorry I didn't have a long list of that, just because I think the tax law confuses it. If I can find a place that explains maybe deductions a little more thoroughly, I'll be sure to share that with everyone. Thanks for that question, Peter. Any other questions? All right, if not, I'll just go through the last two slides. So we are now getting into our busy season as we prepare toward open enrollment. The next training that we have available is the Certified Application Counselor Pre-Licensing and Enrollment Assistor Continuing Education Training, which will be on September 27th from 9 to 3. I'm sorry, lunch will be on your own. That's typically what we do since we are borrowing space. It will be held at St. Joseph's Hospital, and we will have our partners from the Department of Health Services providing the Badger Care 101 portion in the morning, and then our partners from the Office of the Commissioner of Insurance providing the insurance regulations in the afternoon. So this training can also be used for agents and brokers who want to be added to the Milwaukee Enrollment Network agent referral list. We do have a requirement that to be added to that list, you do have to complete a Badger Care 101 training. And typically there's been a webinar that's been offered, and I don't think it's offered any longer. So this training can substitute for that. So if you have partners that want to be included on our agent referral list, please feel free to let them know about this training. It's free, and they can attend that morning session, because the Badger Care portion will be 9 to noon, and then the insurance regulations for CACs will be 1 to 3. And I had one question about this asked. Will 6 hours of training count as the 8 hours? Typically in the past, it has. We've gotten permission from the Office of the Commissioner of Insurance to allow that training, even though it doesn't have a full 8 hours of content, count as the 8 hours required for CACs to get their continuing education credit. As for the folks that are becoming new certified application counselors, they will still need to complete another 8 hours to complete 16 hours of pre-licensing training. And that's for them to become certified the first time. Will it count as continuing education for insurance agents? I will verify that with OCI to see if that can, but I know it at least counts for you to be considered on our referral list. And I know you already are, Hussein, so thanks. But I'll make sure to figure out if that can count as continuing education. Good question. All right. And then just as a final resource, these are all the references that I used today. I also want to thank my enrollment outreach fellow, Kelly Rush. She's interning with us at Covering Wisconsin for the summer and fall, and she helped me get this presentation started, and I really appreciate her efforts with us. If there's any other questions, I'll take them now. Otherwise, we will give you a little bit of your time back for the rest of the day. All right, please complete the evaluation, and I hope you have a wonderful day. Thank you so much for your time.